In this video, I'm going to be covering two common soft tissue related causes of hip pain and dysfunction. What's up everybody, Dr. Matt Maggio here, creator of the Peak Method and founder of the Soft Tissue Revolution, where we teach self-employed massage therapists a new treatment system that focuses on working smarter, not harder, allowing them to cut their treatment times by 50% so they can stay healthy and help more people get out of pain. This video series is going to be a two-part series really diving into hip pain, hip dysfunction, functional-based testing, and functional-based treatment. So in the first part, we're really going to get into the history and soft tissue structures that can cause hip pain. So the first video I want to link up is from one of our training modules in our CEU courses, going over what a soft tissue problem looks like when it presents in the hip.
All right, soft tissue, my favorite thing to treat. It is the most common cause of a lot of problems that we see in the human body. Basically, over time, muscles get overworked with bad postures, doing too much, not taking care of ourselves, getting beat up, and it makes those muscles weaker, less flexible, form scar tissue. So definitely where they feel it, what the quality feels like, they're going to say, like dull, achy, tight, that kind of stuff. Severity, same as a ligament, it kind of lives in that 3 to 7 range. Provocative, definitely feels worse as you use it, better when you don't use it. Have they had trauma? Yeah, when there's trauma, there's going to be a lot of scar tissue formation as well. What they do for activities or what they do for a job, are they sitting a lot? Are they doing a lot? Vice versa. And I tend to find this a lot in the muscles of hip flexion, specifically like rectus femoris, iliacus. I see it a lot in the adductor magnus, gracilis, and a lot of those deeper muscles. And I will see it a lot in the posterior hip cap.
Another issue we end up seeing in hip pain presentation is actually a problem with the ligament. I consider the ligament under the umbrella of soft tissue dysfunction, but it has a little bit of a different presentation with that. So the next video I want to link up is from one of our CEU courses, going through exactly clinically what a ligament problem looks like in hip pain and dysfunction.
Next one's going to be ligament. Ligament is actually really important in overall hip function, definitely where they feel it. When they have a ligament problem, they might have it in the front of the hip, but they're definitely going to feel it in the side of the hip. And they'll describe it as like a tight, achy, kind of restricted type of thing. Symptom intensity, usually it goes in that, like, if we're doing that 0 out of 10, 0, no pain, 10, you wouldn't care if we cut it off. It usually lives in like that 3 to 7 range. Usually gets worse with activity, better when they don't use it. Trauma in there as well. A lot of times if there's like high impact, maybe they play a sport or they're doing a lot of heavy lifting, that ligament gets stretched a lot. Also what they do for their job, are they a blue collar worker? Are they using their body a lot? Are they beating it up? And the ligament that I end up seeing a problem is called the posterior hip cap. So it's on the back side of the hip cap. So basically it helps to attach the femur when it comes into the hip itself. And ligaments are like a ball of yarn that kind of open and support when this happens, and they get really stretched out. So a lot of those people that are coming in with that anterior hip pain, that tightness, and some pain on the outside of the hip, a lot of times it started as a capsule problem as well. When it's just strictly a capsule problem, they might just feel like that deep aching type of pain. When they use it, they won't feel as much as like that popping and clicking. Popping and clicking means you also have that labrum issue in there as well on top of that ligament itself.
So a couple of take homes from each one of the videos. Number one is the importance of taking a thorough history. So many soft tissue practitioners just want to jump right into treatment. They don't collect enough data. Then they're ending up just really winging it and just throwing some things at it, trying to figure out what works and doesn't work. I always say, if you can't figure out what a problem is in the first place, you can never fix it. The other portion is you have to start answering questions of why. Why is that area tight? Why is it painful? Why is there inflammation? Why is there swelling? Because if you can't answer why, once again, you don't know what the problem is and you can't fix it in the first place. So the next video I want to link up is actually a functional based testing of the hip joint itself, those soft tissue structures, everything like that in our method called the Peak Method. I'm going to link that video up right now.
The next test we're going to do is the hip flexion functional test. So with this one, the client's going to be laying just on the table, just like they are, legs straight, nice and relaxed. And then what you want to do is kind of get their hands out of the way. Sometimes clients will have their hands here. You want them down on their side or kind of tucked underneath. And what we're going to be doing is seeing how easily the quad can come up and touch the chest. So we're looking for a couple things here. So the first thing you do is just bring it here right to neutral. A lot of times when someone has a really bad arthritic hip or some degeneration in there, it might be really tough to get in that position. You're gonna pick that up as you ask some of those history questions. So what you're gonna do is put the leg here nice and easy, and you're gonna go right behind here, and you're gonna hold right behind the knee. And what we're gonna do is we're gonna bring it straight up towards the chest. Now, a lot of times when people will do this, they'll cheat and kind of let it go out to the side here. That's not going to give you the full functional evaluation of what's going on. So you're going to go here, you want to keep everything very parallel and very neutral. And we're going to bring it straight back towards the chest, nice and easy. And we should see that this quad can easily go up and touch the ribs. This is a full functional test. Sometimes you will see some compensations where this hip will come up. If you do see that, they're cheating, keep that back down. And sometimes with that, you have to hold the other leg down to get a better idea and go in like that. What we're testing here is a couple things. We're testing to see if the adductor magnus is actually limiting that, or the hip capsule as well. And sometimes there can just be some degeneration in there to the capsule, to the labrum, to the joint itself. But a nice clean test should come up very easy and have a little bit of spring at the end as well. So this is normal direction when you're doing that. Sometimes with a cheat, what will happen is when people have some problems in there, they'll go out here and it doesn't give you that full range. And you also got to really watch out for that other hip, because a lot of times if people are coming in for hip pain, they're going to have some of this restriction anyway. And if you don't notice that, you're going to have a bigger problem in there. And once you're able to get that motion, you should see that that's functioning really good. But if it's not where it's at, this is where you want to get in there and take a picture so you can give them an idea of what normal versus abnormal is.
So now that we have some clinical data, you know, in the history points, what it presents with, where they're getting the pain, what the pain feels like, how severe, what makes it worse, we start to generate our list of what's going on. Then based off of that, we do a functional based treatment. Now what we're doing is we're getting a lot of objective data. Objective data is really important. Functional based tests tell us what's going on. Yes, the symptoms are important, but they don't tell us everything. And usually what I end up finding in a lot of musculoskeletal treatments are we're really only addressing the symptoms and we don't take a look at the function. And then there's other areas where they go too far to function only and don't address the symptoms. It's somewhere in the middle. And a lot of times when there is a soft tissue restriction, and that soft tissue restriction, the most common cause of pain, weakness, decreased flexibility in the human body is an accumulation of scar tissue in and around the muscle, around the ligament, and around the fascia. And when that happens, it will present with limited range of motion, which you're going to find in that functional based test. So in the next part of this training, in part 2 of hip pain and dysfunction, I'm going to be going over advanced palpation of the adductor muscle and the posterior hip capsule, 2 of the most common causes of soft tissue dysfunction in the hip and leading to hip pain. And then I'm also going to go through treatment of those areas as well, so you can get results driven treatment and get treatment that lasts. So if you like the video, share it. Go grab our free training. We go through a lot of this critical thinking, figuring out problems, solving problems, and becoming a true solutions provider. Also take one of our CU courses that are available online or in person, where you really dive into my method, the PEAK method, and get to where I say working smarter, not harder, and cutting your treatment times by 50% so you can stay healthy and help more people get out of pain. Appreciate you guys watching the video, and we'll see you on the next one. Bye.